So hi guys, Lori Horseman here, Vice President of Cognitive Care for Traditions Management. And tonight we're going to be talking about a topic that seems to be commonly asked is what is dementia? And I'm trying to help you understand this new journey that you are now on. And I call it that because it's a journey that no one really knows what to expect, what's coming, what to plan for. And it's not really something that people really share or talk about until they're in it with you. So we're going to discuss this tonight. And as always, a little bit about me, Vice President of Cognitive Care for Traditions Management. And I have about 26 years of experience with my background in dementia. And I was also my dad's caregiver who had Lewy bodies dementia. And then a few years later, my oldest brother died of frontal temporal dementia. So I've been on both sides of this as a personal caregiver and then working in assisted living. But what we're going to talk about tonight is understanding what dementia is. And as always, if you have a question, feel free to put it into the chat box, and I'm happy to answer any questions you might have as we go along. You don't have to hold on and wait till the end. Just feel free to interact as we go. So what is dementia? So when we talk about this, I always tell people that dementia is basically the loss of cognitive functioning. It's not a diagnosis as such, because dementia is an umbrella term that we use to describe several different things going on with thinking, your remembering, and your reasoning to an extent that it interferes with the way you do your daily activities. Things like being able to, balance your checkbook and plan a meal. It starts to interrupt the way you do life. Some people with dementia can't even control their emotions. Some, their personalities might change. So dementia is very, very unique. When we talk about it, like I said, it's an umbrella term to describe symptoms that are going wrong with your thinking and your cognitive functioning. And there are over 120 different types of dementia that we now know of, and almost over 80 different types of Alzheimer's. And those are actually two separate things. We're going to talk about that. Dementia ranges in severity from very, very mild stage, which we call mild cognitive impairment, where you have just a few things that are affecting the way you function, to the most severe, where there really isn't much you can do for yourself and you depend completely on somebody for all of your needs. So there's various ranges to this disease. It's more common in people as we grow older. It's usually about 1/3 of the people over the age of 85 have some form of dementia, but it's not a normal part of aging. Okay, let's talk about that for just a second. What's normal? What's not normal? Okay, it's normal to slow down as you get a little bit older. It's normal to have a harder time remembering the rules of a game. It's normal to have a hard time remembering some words. As we get older, you forget somebody's name or you forget the name of a place, but somebody can jog your memory. You're like, oh yeah, that's it, I remember. That's normal. It's normal to be on your phone and ask somebody, where is my cell phone? I've seen that. That's normal. That does not mean you have dementia. But what's not normal? It's not normal to go to the grocery store and not even remember why you're there. You can't remember how you got there, and you don't know why you're there. It's not normal to be driving and suddenly forget where you're going and how to get there. That's not normal. It's not normal to be able to forget someone's name and not be able to recall it at all. And even when somebody gives you the suggestion, you can't, that's not it. That doesn't sound right. So that's not normal. So I always tell people there's normal aging as we age, and then there's the stuff that you need to flag a red flag on. Now, many people can live well into their 90s and never have any signs of dementia. So getting dementia is not a normal part of aging. I don't want people to think that that's just how it goes, because it's not. There are several forms of dementia, like I said, over 120 different types of dementia, and over 80 different types of Alzheimer's. So there's a lot out there, and some of them can be linked to hormonal imbalances. Some can be linked to having diabetes. Some can be linked to ADHD. Some of them can be linked to being an alcoholic your whole life. Some can be linked to various types of psychiatric disorders as well. So a person's symptoms can vary on the type of dementia that they have. So this is one of the things where I tell people, the signs and symptoms that you're looking for, there's some pretty general ones. So some of the biggest ones is that, your brain, the way it functions is it sends an electrical impulse from one side to the other. And that's how you catch it and can make sense of what's going around you. So what dementia basically is that healthy neuron and that nerve that you used to have stops working. It starts to lose its connection and it doesn't send that message anymore. So there's a breakdown between the message. So everyone loses some neural connections as they get older, but dementia is like fast and it doesn't make sense, and you can't rebuild what you lost. You can learn something, but you can't retain it. So it's a little bit different. So taking a look at the signs and symptoms of dementia, okay, this is just a smattering that I put up there, but this is probably the most common ones that I see. Experiencing memory loss, poor judgment, confusion, okay? Maybe you don't understand what somebody is asking of you, or the poor judgment, giving your credit card information out over the phone to somebody who calls, getting confused on what somebody's asking you on the phone and you give away personal information. That you shouldn't do, and that's not normal. You don't want to do that. Difficulty speaking and understanding or expressing thoughts. This is a big one because there is an actual type of dementia that you don't understand the words that you're trying to say. So it sounds like you're kind of making them up as you go, and you'll get muddled up. It doesn't make sense what you're reading or writing. You might not even understand a danger sign like do not enter. You don't understand what that says. Wandering and getting lost in a familiar neighborhood. That's a big one, because wandering is one of those things that you want to pay attention to. It's not the same as going for a walk. Wandering is, they're kind of off, and some dementias you can only go in a forward motion. They don't know how to turn around and come back, so they get lost in a familiar neighborhood, maybe one they grew up in. Oh, so we have a question? Go ahead.
We do, Lori. The question is dementia hereditary? My dad and my grandpa both had it. Does that mean that I will get it too?
Okay, that's a good question. So let me put your ease your fears. Only 1% of all dementias are hereditary. Now, here's what we do know is that the way you've learned to handle your stress and the way your lifestyle, you've learned that from your family members. So a lot of dementias are brought on by diet, stress, the way you do things, the area in which you live in. So let's talk about that for just a second. So just because dad had it and your grandfather had it doesn't necessarily mean you're going to get it, but it does mean you've probably practiced some lifestyle choices the same way they do. Maybe you practice handling your stress the same way. Maybe you eat some of the similar foods that they used to eat. It could be highly processed foods, rich and dense with calories and sugar or processed foods. It could be that you're also a smoker because your dad smoked, or maybe you're a drinker because your dad was a drinker, and that's how you learned how to reduce your stress. So one of the things that I learned, because like I said, my dad, my brother, and my grandmother, I have to pay attention to this, but there are some learned behaviors there. One of the things that I thought was interesting in my research is that people who are very, very negative have a tendency to be more prone to getting this disease, getting more illnesses. So you want to, be kind of careful and be cognizant of how do you process things? Do you sleep the way you should? Do you get angry at people? Do you, harbor in stress? What are the foods that you're eating? Are you eating the same things that are not necessarily healthy for you? And we're actually going to talk about that. So that's a good question, but don't stress over that and don't call it in and don't assume that just because they had it, you're going to get it too, because don't do that. There's some things I'm going to teach you to kind of help you with that. But let's talk about the trouble handling money. This is one that kind of was a red flag for me with my father. He just stopped paying his bills because it was too confusing for him. So he just stopped doing them altogether. And I started noticing we were getting a lot of interesting collection statements. And I'm like, what's going on here? Repeating of the questions over and over, or repeating of stories to you. This is a big one. Can't remember they told you that. So they repeat it again and again. Or using unusual words to refer to familiar objects. They're making up their own word. They're making up something that sounds like it should be that, but it's not that. So like I had a friend who would actually use a weird word to describe his wallet. I didn't understand what he meant, but he was making up his own word, but it was the same exact word each time. Not unlike a child when they use the word binky or baba. They know what they're trying to say with it, and they've made up their own word to do it. So this adult brain is kind of doing the same thing because they can't find the right word. But if you listen, the vowels are the same tone. So it's rather interesting the way they do this. Maybe taking longer to complete a normal daily task, like they get, it takes them longer to brush their teeth. And this is one that I often train my staff on. There's 22 steps in brushing your teeth. And it can actually take a while if you don't remember which room of the house you're supposed to do that in. What brush do you use when you're in the bathroom? Is it the brush, the toilet brush, the hairbrush, the shaving brush? Which brush do you use? That's confusing too. And then understanding what goes on the toothpaste. What the toothpaste is that goes on the toothbrush. Is it the toothpaste, the shaving cream, the bath gel, the hair? it gets confusing. And then do I brush and swallow? Do I brush and spit? Do I need water? Where do I get that from? So sometimes it can take longer to do a normal task because you really have to keep bringing yourself back to the task at hand, or losing interest in normal daily activities and events, choosing not to want to go and do things because a lot of times it's because they don't want to get found out that they're starting to lose their ability to focus and that they're going to repeat themselves. Especially if your family keeps telling you you're repeating yourself, they'll have a tendency to kind of back out of activities because generally in the beginning, this person with dementia knows they have it. They feel it. It's off. Because all dementias, all chemical-based dementias start in the left-hand side of the brain. They all start in the left-hand side of the brain where language is. That's all chemical-based. Dementias that are based on blood-based, like strokes, those happen in the center of the brain. But on the left-hand side of the brain, you feel something's off. You can't remember your words. You can't find what you're looking for. You feel like you're kind of lost in time. You walk out to the kitchen and you can't remember why you came. You look around and you see an empty cup in the kitchen sink and you're like, who did that? Who's been in the house? And you remember, nobody's been here. That was me. So you start to withdraw from activities because you notice that your friends are catching on because they're saying, you know, Lori, you repeated that 3 times already. Don't you remember? And you don't remember. So you start to act out. You'll either use aggression to throw people off the scent and use anger, or you might use humor and say, oh, you know, I was just testing you to see if you were paying attention. They might use things like that. Or you might notice they don't really seem to care about people's feelings anymore. They tromp all over it and say mean things that they never would have said before. They're like, well, don't blame me. I'm not the one that's fat. You are. And I never remember my father saying this to people. And I was like, oh my gosh, he did not just do that. But that's the kind of stuff they'll do. And then here's the biggie. There is a type of dementia that messes with your muscle coordination. And you might have balance problems and suddenly fall down or not be able to walk or fall up going up the steps. And those are things that you don't really think of as being dementia, because not all dementias are memory-based. Some of them are personality, some of them are balance-based. So they're all a little bit different. So some people can actually be, have dementias that come with, intellectual and developmental issues. So you need to understand too, some of these different dementias, kind of recognize that the symptoms are a little bit difficult. Like one of the things we're noticing is that people with ADHD, can actually be a type of dementia linked to that. So it's important to consider their current abilities and then kind of monitor the changes over time. So give me another one, Down syndrome. People with Down syndrome, as they age, can actually start to develop certain types of Alzheimer's. So then sometimes it's difficult to understand, well, is this the Down syndrome or is this the Alzheimer's? So you really need to know their current abilities so that you can kind of look for the changes that are coming along with them. Okay, so causes. Here's a biggie. So what are the causes of dementia? All right. So they all depend on various types of changes in the brain. So like I said, there's over 120 different types that we look at. So what causes them? All right. So some of them are environmental. Some of them can be linked to dementia. In some cases, we don't really know, but we're starting to narrow it down because there's a huge amount in the United States as opposed to other countries. You don't really see it as much in third world countries. So we know that a lot of it has to do with the chemicals that we're eating, the diets that we have, the way we go about processing our information, and the way we eat some of our foods. So there are also some rare genetic mutations, although very, very small number of people, that you can actually trigger dementia. Although there is no proven prevention, here's what we do know. Healthy lifestyle. That's going to reduce most dementias. And when I talk about a healthy lifestyle, there are certain foods that you should be eating. There are certain nutrition that you want to make sure you're having. And one of the biggest things is not to be sedentary. So talking about the different types of dementia. All right, so we're not going to talk about all 120, so don't panic. It's not going to go that long. But there are some various disorders and factors that contribute to the development of dementia. So there are some things that are going on. You've got neurodegenerative disorders that result in progressive, irreversible loss of neurons and brain functioning. There are no cures for those right now. We can't reverse them. There is a lot of conversation and talk about how we have some drugs on the market. Listen, every single drug we currently have is designed to delay functional loss, to basically allow for some more dignity, but nothing can reverse it once it gets started. Dementia is a very progressive disease, and it will eventually end in death. And that's one of those things I try to tell people, that I can't reverse it. I can't slow it down. I can buy you better days by teaching you about the disease and teaching you ways to communicate with somebody who has the disease, but I can't stop it or reverse it. So the 5 most common forms of dementia. So let's talk about these, because these seem to be the top 5 that we deal with the most. Like I said, there are so many versions of these too. So Alzheimer's disease, that's about 50% of most of the people diagnosed with dementia among older adults. It affects the brain, and it does the abnormal buildups of proteins. It's the amyloid plaques that you hear a lot about in the tau proteins. This one commonly starts on the left-hand side of the brain. They'll lose their words. They lose the names of things, nouns. They can't come up with the name of the person or the item that they're trying to talk about, or places that they've been. They lose those. Then as it starts to work its way across the center of the brain, it hits the hippocampus. And there, that's your time traveling. That's your wayfinder. That's where they get lost in time. They get lost. Maybe they're going home, but they end up in their childhood home and they can't remember how to get to the house that they currently live in. You might notice that they fluctuate, thinking that they have to go to work, but they've been retired for 5 years. Or maybe they're saying, my mom's waiting on me, but she's been dead for 20 years. And you're kind of like, what is going on? That's Alzheimer's. Alzheimer's is kind of like a gradual, kind of a slow goodbye. As this person, as the disease kind of slowly works its way across the brain, this person doesn't really have too much, I don't want to say they fight with you too much, because what ends up happening is these guys become kind of pleasantly confused. They need to walk a lot. They need to be in a structured environment where they can be safe and wander about freely without worrying about getting into any trouble. And as the disease progresses, the care is going to change for these guys, because as it keeps progressing, they're going to need more and more care. Now, frontal temporal dementia, this is kind of a rare form of dementia. It tends to occur in people. You can actually have some younger cases. We see this a lot in people younger than 65. It's there. And this is one that is a little bit interesting. You're going to have a lot of personality changes with this person. Their front lobe, which is in the front part of your forehead, this is the part where their executive functioning is. This is their filters, where they shouldn't say certain things, how they kind of get out of understanding what's going on around them and keep them out of trouble. They lose this. So people with frontal temporal dementia have a tendency to have a lot of personality changes. They will say some very colorful language. They will use every racial slur, sexual slur, and innuendo they know. And they're not doing it to be mean. There's just no filter there. And they kind of just say what they want to say. They get lost in time. These guys will have what we call confabulations, where they're making things up. And it sounds like they're just making up stories and they're lying, but they're not. They're trying to make sense out of a situation that they're in. So their brain just kind of picks things from across the board to make sense of to why they're there. I had a gentleman who is a huge Jason Bourne fan, and he watched those movies a lot. So he had a lot of memories of those movies, but his brain didn't know those were just movies. So when he was trying to explain where he was using some scenarios out of Jason Bourne movies to make sense out of it. And we went with it. So we'll have a lot of delusions also with these guys. And they'll think that somebody's in their room, or there's a dog under the bed, or somebody's coming in and taking my things and they're stealing my stuff. And, one of the things I often train on is that we don't argue with them. We agree. We help them shoo the dog out from under the bed. We tell them that they will get that guy out of their room. We agree with them because we don't want to make them feel that they can't trust us and that we don't trust them. Because the respect is a big thing, and treating someone with dignity is a big thing. So even though they never flew a helicopter in some movie, they didn't do that, but we go with them and we let them feel like they did. Because the one thing I will tell you that you definitely want to do is, when we have hallucinations and delusions and confabulations, we don't correct. We let them go with it so that they feel like they're being validated. We don't do reality orientation with them. Is there another question?
There is. The question is, my mom keeps asking us to go home. She says her mom is waiting for her. My grandmother died years ago, but my mom thinks that she's still alive. Every time we try to tell her that grandmother is no longer with us, she becomes upset. Do you have any advice?
Yes. Now, I want you to keep an open mind on this one, okay? Because it's going to sound like I'm telling you to lie, but here's what we're talking about. When we use the term that we meet them where they are, that means we meet them where they are mentally in their head, okay? So if she's saying that she wants to go home and that her mom is waiting for her there, she's time traveled. Her hippocampus is kind of coming backwards in layers. So she thinks she's old enough now that her mom, or young enough now that her mom's still alive. And when she means she wants to go home to see her, home is not always a place. Sometimes it is, but more often than not, it's a feeling that we're talking about. And in her case, home is her mom. Mom is how it made her feel. Mom probably made her feel secure, and she needs that feeling of being secure again. So she needs to know that she's okay. So that's the first thing of that. The second part is when we say that grandma's dead, okay, when you're telling her that her mom is dead, you've just ripped her foundation out from underneath her, because in her world, she believes her mom is alive, and she is in her world. So this is one of those things that I tell people, meet them where they are. Their reality is their truth. Their truth is their reality. Their truth is not our reality. They're no longer in our reality, and they can't be. So if it feels like you're lying, keep in mind that we're going into their world. And in her world, what gives her comfort is knowing that her mom is alive. There are very few things that this disease brings about that are positives, but if it can be a positive that she doesn't remember a painful death, and in her world, that person is still alive and happy and healthy, and she's going to go home to see her, let that happen. So what I always tell people is like, oh, your mom's at home. Oh, cool. So what would she be doing right about now? And kind of give a plausible, don't say she's at work, because maybe mom didn't work. But if you knew your mom, her mom always ran errands, or her mom was out with her aunt running an errand, it's like, well, she's out with Aunt Shirley. She's probably running a few errands, and she'll be back this afternoon. And she asked you to stay with me. She'll probably like nod and go, okay. It's like, how would you like to do an activity with me? Or maybe, how would you like to come over here and help me make these cookies? And then we can give them to her when she shows up to pick you up. And sometimes it's just that diversion is all it takes to get her off of that. Because remember, mom and home are words that we use when we need to feel comforted and soothed. So if I can give you a soothing activity, I can take you off of needing to go home. So frontal temporal dementia brings about a lot of those types of hallucinations and delusions. And the biggest thing I can tell you is to go into it with them, meet them where they are, validate it, and then take them down a different path. Food is probably one of the best ways to get their mind off of what's going on. And food is one of the biggest diversions that I use, from ice cream to cookies to whatever it is their favorite thing. Now, Lewy bodies dementia is a rare form of dementia, and this one is different. It does not affect their short-term and their long-term memory in the beginning. It affects their muscle coordination and movement. These people will often have it misdiagnosed as Parkinson's disease because they might have tremors, or it gets completely missed because it's a random fall. They can fall going up the steps, they'll drop something, they lose their depth perception, they bang something to the table, they knock into things, and they're constantly covered in bruises, and then it stops. And it can lay dormant, to what it seems like to you and I, for a couple of years. And then it pops back up with him repeating of his questions, and then waking up in the middle of the night with the delusion that he needs to get up and go to work, even though he's been retired for 20 years. He'll tell you all about who's on schedule that day and what he needs to do. And you're like, you've been retired, you don't work. And he's popping up in the middle of the night, which looks like he's coming up out of a bad dream, but he's not. This is the disease. Lewy bodies is wicked. It hits the muscle memory and attacks the motor skills. So this person could almost pass a mini mental exam at times, but he can't even tie his own shoe, and he can't remember how to talk and swallow because that part of the brain is what's affecting his dementia. So this is a different one, and this one happens and travels very, very fast. These people will have full-blown hallucinations where they can see, hear, smell, feel, and touch something that's right there and have a complete conversation with them, and yet they're aware they're having a hallucination. These are tricky. So this one you have to be careful. When he's hallucinating with you and he said, that's not really happening, is it? This is where you go, okay, Dad, what do you think? And you kind of have to feel it out, and you have to read his facial cues to figure out, is he second guessing himself? Because I don't want him to do that. So you really want to support them. These guys will have huge, super paranoia, highly suspicious, because they're fully cognizant all the way through the disease that they're hallucinating. And they can't stop the hallucinations. This is the one that you really want to watch out for. For some reason, it does come with a high rate of attempted suicides, especially among men. That's the disease that Robin Williams had. His hallucinations were so real to him, he was afraid he was going to hurt his family. And that's why he did what he did. So Lewy bodies is a tricky one. That's one that goes really, really fast through the system. You also want to be careful with this because they'll have like these states of fluctuations. Like all 1 minute they can do something and the next minute they can't. And often what I hear, and it's interesting, families will say, oh, he's doing it on purpose. He's just trying to get attention because mom's been sick. That's how I know. Typically, it's Lewy bodies is when the families say he's doing it on purpose. Because 1 minute he can do something and the next minute he can't, and he's sitting on the couch drooling and looking like he's out of it. That's Lewy's. Now, vascular dementia is a little bit different. It's not a chemical-based dementia. It doesn't affect the left side of the brain. It doesn't do anything. It starts dead center. This person was fine, and then they had a series of small strokes or one big, large stroke with huge damage to the middle of the brain and completely changed their personality. This is a blood flow issue to the brain. And these guys can go for long, long periods of time. They could last, stay the same for a long period of time, have another stroke, and boom, they change suddenly and they're going across that way. So these guys are different. Their personality changes are the biggest thing is they'll have huge emotional outbursts, crying jags and laughing fits, and then almost to the point that it sounds maniacal. They can cuss you out and get so angry with you. And then they like fight with you on stuff, and then they'll turn right around and it's like they're fine. And you can engage with them. And then they are like flying off the handle again. So these guys have what we call a Suter-Bulber effect with their emotions. And it's really tough for them to get on top of this. It takes a while till it starts to venture out. And then it goes from the middle of the brain to the outer part where it starts to resemble Alzheimer's towards the end. So this is a tough one to take care of. And then there's mixed dementia. Mixed dementia is 2 or more types of dementia. It's usually Alzheimer's with a buddy. So typically we see Alzheimer's pairing up with vascular dementia or Alzheimer's pairing up with Lewy bodies dementia. And what's unique about it is that you might start out with Alzheimer's disease and you exhibit the typical word loss, confusion, just kind of general, pleasantly confused type of lost and confused. But then when you get the vascular dementia paired up with it, it's kind of like the Alzheimer's takes a back seat, the vascular comes up and you got these huge emotional changes. And as those emotional changes are happening, they don't really seem to be confused as much as they were. But as the vascular dementia then subsides and the Alzheimer's comes back out, the moods subside, but we're back to being confused again. So mixed dementia is kind of quirky. It's usually women that we see get this. So if we start out at a younger age and we have Alzheimer's hit us under the age of 65, there's a pretty good chance you could end up with mixed dementia before it's all over with. Doesn't really quite seem fair. We multitask too much. So what are pseudo-dementias? Well, don't get excited, but there is such thing as reversible dementias. And these are things that cause, you struggle with trying to keep track of where you are, what you're talking about. They cause confusion, other types of conditions that look like dementia. And it's usually conditions like stress, anxiety, depression, delirium. If you've ever known anybody that comes up out of anesthesia from a surgery and they don't quite seem like themselves, I have been told by some of my friends who are anesthesiologists that it can take 3 to 6 months sometimes for the brain to literally clear the anesthesia. And as it does that, you might look like you have a form of dementia. Brain fog is a really good example of it. So side effects of certain types of drugs, even like UTIs, a urinary tract infection in an older person can make them look like they have some form of dementia that it's not, it's reversible. Another question?
We do. The question is, I've had a brain injury from a past car accident. Should I be concerned about getting dementia later in life?
Short answer is yes. You always want to take care of your brain health. So if you think, the rule of thumb, the golden thumb is that, the golden rule of thumb is that if you got knocked out and you're unconscious, there was some damage that was done. So you want to make sure that you're staying up on top of this stuff. And there are some exercises that you can do. There are some cognitive exercises, and this is where I'm big on this. If you think of your brain like a ball of plastic, which essentially it is, that's what neuroplasty is, it's plastic. You can change it and alter it yourself. The more you try to learning a new task, learning a new skill set, learning a foreign language, doing different types of games like problem solving, speed drills, things along those lines, you can actually create new neuroplastic growth and kind of help your brain with some of this. So if you've had a serious brain injury in the past, you want to make sure, you might even want to have, check with your doctor, see if it's possible to have a scan done. Is there anything that you can be doing? But you definitely want to do everything in your power to keep your brain as healthy as possible. And just as an interesting FYI tidbit, do you know the #1 sport that causes some of the most brain damage. And it might not be what you're thinking because everybody goes football. It's really not. What I've learned is soccer is one of the worst for your brain because you dribble the ball with your head. So all those little tiny hits to the head, no, they're not causing concussions, but they're causing soft spots on the brain for that little plaque to deposit. I thought that was interesting when I was told that. Soccer, one of the worst sports for your brain. So here's where we have identified some conditions that can lead to dementia-like symptoms, and it's actually on here. There is a grain disease that can actually cause a degenerative, like a late onset degenerative disease. Creutzfeldt-Jakob, that's a rare brain disorder. We used to call it mad cow's disease. Huntington's disease, this is an inherited progressive brain disease. This one is inherited, but it's like, again, only small percentage of this one. Chronic traumatic. So if you have chronic trauma to the head, if you're one of those people like a boxer taking lots of blows to the head, repeatedly blows to the head, brain injuries, this is where you want to flag and be careful because this is where that can happen. And then HIV, actually, there's a type of dementia that comes with HIV virus that spreads to the brain. So if you have like high fevers in the past, lots of infections, if you've had traumatic brain injury, you want to be careful. And you want to make sure that you're doing everything you can to keep that brain healthy. So you want to make sure you're cleaning up the diet, that you're, doing your brain exercises, and that you're not doing anything to add to any type of brain damage. So how is it diagnosed? Okay. This is the one I want you guys to all be sure you get down. Dementia is not a diagnosis. Alzheimer's would be a diagnosis. Frontal temporal would be a diagnosis. Lewy bodies would be a diagnosis. But dementia itself is not a diagnosis. So what doctors usually do first is they determine whether that what's going on with you is treatable or if there's really something cognitively going on. Then at that point, we need to do, your general practitioner can do a physical exam. They're going to measure your blood pressure. They're going to look at other vital signs and lab tests. We can draw blood work and then check other fluids. There's actually a new test out that right now, as far as I know, insurance is paying for. You can do a spinal fluid draw. It's an old misnomer that you cannot diagnose dementia until after you die. That was true a few years back, but now we can actually look at the living brain tissue. We can look inside your head and see what's going on. We can do a PET scan to see what's going on. We can check hormone levels. We can check blood levels. We can check all kinds of different levels. And we're going to also do a medical review of their family history to look at, are you at risk for dementias? We can look for an APOE genetic gene marker and look to see if there's anything going on there. So the way it's diagnosed is not with a mini mental exam. We really have to dig a little bit deeper. We need to do some cognitive neurological tests. We have to assess how you think, your physical functioning, different types of assessments for your memory, problem solving, language skills, math skills, balance, sensory, response, reflexes. There's a lot of neurological tests that go into this. And then of course, we're going to do a psych evaluation. I got to make sure that this isn't a psych thing versus a dementia thing. Because having worked in both of these fields, they're trying to think here, bipolar personality disorder sometimes can look like this, schizophrenia sometimes can look like frontal temporal disease, and they're not the same. You do not treat them the same way. So you want to make sure that you're ruling out anything before you start to make sure that it's dementia. You don't want to just say, oh, it's this, and send them home with a drug. You really want to dig deeper than just saying it's dementia. You want to go a little bit further with this. Brain scans are probably one of the easiest ways to do it. My favorite is the PET scan. They put the electrodes on and they look for the living tissue. Even sometimes they'll do like a CT or an MRI on you, but the PET scan is probably the best one. You go home with it for a while. Also, you sit there, they'll ask you some questions and they look to see what fires up. So we're looking to make sure that all parts of the brain are working the way they should. You can actually start to see imaging on the brain if part of it is starting to shut down. And that lets us also know what type of dementia it is. And then also we can start to stage where you are. Now, keep in mind, staging doesn't mean how much longer you have to live. Staging means how much of the brain tissue is left for communication levels, because we use lots of communication going on there. Genetic tests, this is a biggie. Some dementias can be caused by a person's genes, kind of rare, but we have those. And then there's genetic tests that can help people know if they're at risk for dementia. And it's also important, if you are going to take those tests, you might want to have, a counselor ready to talk to, because sometimes finding out that you're at risk for those can do some damage, mentally to you, also thinking, oh my gosh, it's going to happen. And I always tell people, don't go calling that in. You want to stay as positive as possible and do everything that you can to offset it. Blood tests are becoming pretty positive. to use for these things, almost a pretty good return on this. You're looking for that beta amyloid plaque protein that accumulates in people. You're looking for that one. There also is like you can do different types of other tests related to dementias. We're still coming about with some of the research on them. Like I said, the spinal fluid draw, that's been pretty popular in Europe, and that's one that I've been watching how they're doing that one. Rather simple, and they can see it. Is there another question for me?
There is. The question is, my mom is only 56. Is this still Alzheimer's if she's that young?
Yeah, probably if she's been diagnosed with that. So it doesn't have an age factor to it. In the United States, we actually had a gentleman that was diagnosed at the age of 24 with full-blown Alzheimer's. And we linked it back to a lifestyle situation for this gentleman. He is now, I think, 28 or 29 years old, and they're not expecting him to live too much longer with it. But yes, they can actually be Alzheimer's in your 40s, in your 50s. It's not an old person's disease anymore. And that's what I tell my staff when I'm training them. In this particular person's case, he began drinking Diet Coke at a young age. And if you know it's in Diet Coke, then you know that aspartame is not good for your brain. It's one of those things that has a strong link to early onset Alzheimer's and dementia type symptoms. And then he started playing football in the 3rd grade, had a couple hits to the head, but didn't think much of it. And then as a high school kid, he vaped like most kids do. He just did the vaping because that was cool, and ended up with basically the perfect storm. And in college, he was having a hard time keeping up with the studies. So the families thought it was, you know, maybe a drug overdose, maybe it was not overdose, but maybe drugs that were causing him to act like that. And they ended up putting him through a series of tests. It took a while because nobody was testing him for dementia in his 20s. And it took I think a year or so of testing, and they discovered that it was full-blown dementia or full-blown Alzheimer's at the age of 24. So it's not an old person's disease. It is a lifestyle that you're doing to yourself. So unfortunately, yeah, it's probably Alzheimer's for her. Early detection is great, because one of the things that I wish we did more of here in the United States, and I don't think we do this right, is we don't like to talk about it. If we feel ourselves slipping, we'll hide it from people, and it's considered a taboo. So, you know, we don't want to talk about what's going on, and we hide it. And the problem is that most of the drugs that were created to help us, the Ariceps, the Razidine, all of those that were designed to help you, were designed to help you within the first 6 months to a year of getting those symptoms. Problem is most of us hide it in the United States. We don't talk about it until probably year 5. And by then we're so far into it that those drugs aren't really going to help us as much as we'd like them to. So, and sometimes a person with dementia will agree to donate their brains to science, you know, afterwards, so that we can see them and do some research. And that gets rather interesting. One of the things that I tell people is that, you know, when you're doing that, it gets, yeah. When you're doing that, because I want to see if I got a picture for this one. I think I do. Yeah, I do. So this is what I want to show you. That top brain is a healthy brain. Well, obviously it was healthy, but that came out of a healthy functioning man. And the bottom brain came out of an individual. These two brains are the same age, by the way. So these both came out of people about the same age. The bottom brain has Alzheimer's. So what I want you to take a look at is this brain, what you're looking at, the forehead is to the left of the picture, and the back of the brain is to the right of the picture. So you're looking straight at the left lobe, the left side of that brain. Now, if you look at it, it's nice and tight and compact and dense at the top. And that's what you want your brain to look at, like a ball of plastic. And you see all that little neuroplasty in there, and it's linking everything together, and it's nice and tight. But down at the bottom, what you're seeing there, that sticky, cobwebby type of stuff, that's the dementia. You're seeing the plaque on your brain, and you're seeing those sticky things called tau. And that's actually what's going out to the sort of the brain and kind of like just you know, literally destroying it. That hole that you see there used to be the left lobe. And as it ate through that brain, that person could no longer find their words. They could no longer find the names of things. They started losing the names of everyone they knew, and it didn't make sense to them anymore what they were looking at. And then as it started to work its way across the brain, you see that it's there in the center part of the brain. That's the hippocampus. That's your wayfinder. So it starts to eat away at those layers of time. Because in your brain keeps track of time in decades. It keeps track of it in layers. So if you're 80, you have your 80s, you've got your 70s, your 60s, your 50s, your 40s, your 30s, all the way down to your being a teenage years. And what happens is for you and I, time is linear. We know that breakfast comes in the first part of the day, then lunch, then dinner. And there's actually an ordinal pattern to our day. Time is not linear for that brain. They go up and down and all over the place. So this person could remember that something that they did this morning and then time hop in their brain right back to being a 20-year-old, and then hop up to something that they did when they were 40s, and they're all over the place. And you can see why, because it's literally starting to destroy it. And you can actually see how the membrane is cut. So as it starts to dissolve, it's gone. You're not going to say something and jog people's memories back. That's why I always tell people when people come in and say, Mom, what's my name? What's my name, Mom? What's my name? And they think that they're helping to jog a memory. There's nothing there to jog. So you asking that type of question isn't going to help your mom at all. Matter of fact, what it ends up doing is it ends up irritating her and making her more angry than anything. So that's why I tell people they can't do it. They can't do what you think that they can do anymore. So who can actually diagnose dementia? Well, primary care physician is where you want to start. Okay. They're going to look for things like changes in your thinking, your movement, your behavior. They're going to look for personality changes because this person has known you for some time. They're going to look for things, but then they're going to have to refer you to a neurologist, because a neurologist is a doctor who specializes in understanding disorders of the brain and the nervous system. And they're often consulted, and they're the ones that do the diagnosis for dementia. Geriatric psychiatrists, neuropsychologists, geriatricians can also help diagnose dementia. And your doctor can help you find a specialist. But a doctor, primary care physician, an ER doctor, they typically can't, because they're going to ask you a series of mini mental exam questions. But I've met people who could pass that exam that had dementia, and I met people who couldn't pass that exam because they've worked a long week, new mom, they were tired, they were foggy brained, and they couldn't pass that test. So that's why I tell people a mini mental exam is not a true diagnostic test for determining whether or not you have dementia. There's more to it than just answering a few questions. So this dementia journey is not one that you can truly prepare for. You have no idea what to expect. You have no idea what to plan for. You don't know what to pack. You don't know when it's going to end. You don't know what to do. And I always tell people, you don't need to take this journey alone. You feel like you are, but we're here to support you in this journey. We're here to give you as much advice as we can. And I want you to know that you never have to hesitate to reach out to any of us with questions. All of our staff at Traditions have been trained to understand this complex disease. We're trained to walk you through it. No question is a dumb question. This is one of those things where when I was on this journey with my father, I didn't know what I didn't know, and I didn't know what to ask for. I needed help, but I didn't even know what kind of help to ask for. I didn't even know what I needed. So it's one of those things that if you're not sure, reach out and ask us. Because like I said, this is a journey. And one of the things that I can tell you, having come through this and I'm on the other side of this now, is you don't want to wish too many things away too fast, because the only way this journey is going to end is through death. And that's not something you necessarily want to have happen either. So if you have the opportunity to be with that person and you just don't know how to connect with them, talk to your people at Traditions. Go and talk to that memory care director. Go and ask that specialist. She can give you, and he can give you, techniques on how to connect with mom or dad. They can give you ideas on how to use techniques that I've taught them, hand under hand techniques, how to communicate with them, how to, connect with them, because it's all about connections. Another question?
We do. The question is, how would you recommend that I help my dad from falling so much?
Mm-hmm.
He won't remember to use his walker and he keeps falling in the memory care unit.
Okay. I get this one a lot, and I wish I could tell you that there was a way that we could stop falls, but falls are going to happen and they're going to progress. And unfortunately, they're going to get worse as they go. Reminding your dad to use his walker. Okay. So if his disease keeps progressing, he probably thinks he's too young to need a walker. He's probably thinks he's in his 20s or his 30s. So why would he have one? Now, some things you can do is you maybe can find out what his favorite color is, and you can dress his walker up in his favorite color. Like I have one lady who absolutely loves purple, and we ended up bedazzling her walker and making it so pretty to remind her to use it. But eventually what's going to happen is she's not going to want to use it. She's not going to remember to use it. And the falls are going to continue to happen, because that part of the brain that helps them to keep their balance is just being eaten away at by this disease. And eventually, like I said, the falls will keep happening until he's in a chair. And even then he can fall out of a chair. So I wish I would tell you that those magic doors are the fountain of youth and they won't fall anymore. They won't have behaviors anymore, but they will. So I wish there was a simple answer, but there truly isn't. The falls are going to continue. All we can try to do is get in front of them. There is some music therapy that we can sometimes do to help with calm down the agitation to reduce the falls, but there is nothing that I can truly do to stop the falls. And I wish I could tell you that there was. So before we wrap it up, do we have any more questions?
We do. There's one other question that just came in. The question is, why would you think that my dad gets so mean and nasty with my mom? He's constantly accusing her of having an affair and says horrible things to her. How best should I handle this?
Okay. Okay. So if your mom lives with your dad, this is where we need to separate them. If dad lives in a memory care unit and is saying things. So I'm going to give you an example of something that I just recently saw in one of our memory care units. And it actually was a husband and wife situation. And the husband has dementia and he's about early to mid stage. He's at that part where he knows something's off and he's angry, and she comes to visit him, and it's almost like he's angry that she's coming to visit him and that he can't go with her. So what I've noticed is that she accuses him all the time. He accuses her all the time of having an affair, which is why she's not there. So the reason we're doing this is that he knows, he's well enough aware with this type of dementia that sounds like the same thing. That's usually a type of frontal temporal dementia. We get highly suspicious. We're trying to make sense out of things around us. Remember how I gave the example of, you kind of confabulate and you grab things from your brain to make sense as to why you're there. What he's trying to do is make sense as to why she's not there with him on a regular basis. So that's why he accuses her of having an affair. This is very common. Doesn't make it okay, and it doesn't make the pain less painful, but it's very, very common. I had a lady that I counseled that lived outside of a memory care unit, and it was so incredibly painful to the family because her husband had passed away. But she said he was having an affair with a friend down the street, because she couldn't make sense out of her brain that he wouldn't be there with her to help her right now, and that the only reason he wouldn't be there is if he was having an affair. So it sounds painful, but it's the only way they can make sense out of why you're not here with me. So what I would tell your mom is this: she needs to distance herself from him a little bit, and she needs to get a little, maybe talk to somebody, have some therapy to realize that she has done nothing wrong. It's just the disease process. It's his brain trying to make sense of stuff. She's not a bad person. He's not a bad person. It's not like that. He has no control over the filters. It's just raw, primitive emotion coming out, trying to help him make sense out of what's going on. He's in that much pain because he loves her that much that she's not there. But if she were there, it wouldn't stop it. He'd come up with another reason to make sense out of it. So it's one of those where I tell them, this is one of those times we're going to have to separate and let the staff get him into a structured daily routine. And the more we can get his brain into that structured routine, the less we can stop it from wandering around in his head trying to make sense out of stuff, if that makes any sense at all. It's kind of like putting him on a cognitive program. And once we do that, they have a tendency to stop lashing out at people that they care about. And as the disease continues to progress and we've got him on that routine, a lot of times we can stop that behavior. But if every time she shows up, she's triggering that, she might need to back off for a little while, and maybe you as the daughter go to make sure he's okay. But you're going to have to work with your mom, because she is going to need some counseling on this, because she's going to feel like she's done something wrong and she hasn't. This is just a normal part of the disease process. So sorry about that, but that happens. Yeah, because they'll be looking around for her, can't find her. Or the other thing too is that he may not recognize her as his wife and start to see the daughter as his wife if he thinks he's younger, looking for the younger version of his wife. So it gets tricky, but this is all very common, very, very normal part of that process. So any other questions?
No, thank you.
We got him? Okay, so we made it. So thank you guys so much. Any questions you have, you can always put them in the chat box. And as always, if you want to ask me some questions one-on-one that maybe you didn't feel comfortable bringing up, that's fine. You can always reach me at dementiainfo@traditionsmgmt.net. And it comes straight to me, and I'm happy to answer any questions you might have. If you're just confused, if you're wondering when is it time, what does this mean? Why is he doing that? What should I do? Or even if you're worried about yourself, there are some training exercises I can give you to keep your own cognition and mental health up there. And then just a reminder, on March 21st, which is also a Monday, we will be discussing the benefits of a daily routine for optimal health. And we're going to talk about it for a brain that has dementia and a brain like yours, why it's important to have that daily routine and why it works in memory care. So until then, I'm going to probably have a couple more of our little mindful moment posts that we'll put up on our Facebook page. But if you have any questions, don't hesitate to reach out to us. And again, you can always reach me at dementiainfo@traditionsmgmt.net. I'm Lori Horseman. Good night, guys.